Hello, I'm Dr. Kavita. In this presentation, I'm going to talk to you about diabetes and its major complications. This presentation would include definition of diabetes, complications of diabetes, an overview of macrovascular complications of diabetes, in which I'm going to explain a bit more about the heart disease and diabetes, followed by preventive strategies for macrovascular complications on the whole. So to begin with, what is diabetes? Diabetes is a condition in which the blood sugar level in your blood is very high due to lack of a hormone called insulin. There are two main types of diabetes, which are type 1 and type 2, of which type 2 is more common, which accounts for about 85% of people with diabetes. In type 1 diabetes, the body stops producing insulin, resulting in high blood sugar levels. In type 2 diabetes, your body does not make enough insulin, or your body cells may resist to the action of insulin, which is called the insulin resistance. Family history of diabetes and lifestyle factors such as being overweight and doing less physical activity are found to be triggers of type 2 diabetes. Unlike type 1 diabetes, type 2 diabetes develops more gradually, and therefore many people are unaware of having type 2 diabetes and are left undiagnosed. Complications of diabetes. Diabetes increases your risk of serious health problems, and this is because high blood sugar over a long period of time could affect various organs. There are two types of complications, which are microvascular and macrovascular. Microvascular complication occurs when there is damage to small blood vessels. This could affect the eyes, kidneys, or nerves. When it affects the eyes, there could be visual changes, which could progress to blindness. It could affect the kidneys, leading to kidney failure, or it could affect the nerves, which is the most common complication in people with diabetes. Nerve damage can cause pain, tingling, numbness, or weakness in your feet and hands. Macrovascular complication occurs when there is damage to large blood vessels. This can affect the heart, brain, or the legs, and in men, it could lead to difficulty in getting or maintaining an erection. So how does it happen? Uncontrolled sugar levels and high blood pressure could damage the walls of your blood vessels on a long term, leading to fat deposition in the vessel wall. So now let's see what happens when the blood vessels are damaged. For example, here you can see the cross section of two blood vessels. The one above shows the normal vessel and the one below shows yellow colored fat deposits called the atheroma that are settled in the vessel wall and causes narrowing of the blood vessels and obstructs the blood flow. This process is called the atherosclerosis. So let's see the risks of atherosclerosis. Smoking, poor sugar control, high blood pressure, doing very little exercise, obesity, and having high fat diet increases your risk of atherosclerosis. Peripheral vascular disease is one of the major complications of diabetes. Peripheral vascular disease occurs when there is narrowing of blood vessels supplying the legs due to atherosclerosis. This leads to poor circulation to the muscles and skin in the legs and feet. There may be pain in one or both the legs while walking. It could also cause delay in wound healing, and therefore even a minor trauma in the foot could lead into a serious infection and may lead to an amputation. Having peripheral vascular disease increases your risk of developing atheroma in other arteries, as well leading to risks of stroke and heart attack. Brain function could also be affected as a result of uncontrolled diabetes. Brain needs a constant supply of oxygen from the blood. Reduced blood supply or a sudden cutoff in blood supply could result in mini stroke or stroke. The area of brain affected and the extent of damage depends on which blood vessel is affected. For example, if supply from a major blood vessel is cut off, it could result in stroke or sudden death. Whereas, if supply from a small blood vessel is lost, it could cause relatively minor symptoms such as weakness of an arm, leg, or both, problems with balance, coordination, numbness of a part of the body, headache, and confusion. Heart disease is a major complication of diabetes. It is one of the leading causes of death among people with diabetes. People with type 2 diabetes are 2 to 4 times more likely to develop a heart disease than people without diabetes. If atherosclerosis happens in a major blood vessel supplying the heart, you could experience pain in the chest, shortness of breath, irregular heartbeat, swelling of the ankles, or it could even result in a more serious event such as a heart attack. People with type 2 diabetes usually have risk factors such as increased blood pressure, obesity, and fat problems, which contribute to the heart disease. Smoking doubles the risk of heart problem in people with diabetes. The more of these risk factors you have, the greater the chance that you will develop heart problems. But don't be alarmed. It is proven that having your blood sugar, blood pressure, and cholesterol levels under control, and by making the necessary lifestyle changes, it is possible to delay the onset and progression of these complications. Therefore, preventing the complications before they start would be the best strategy. So, how can we achieve a healthy living with diabetes? Eat a healthy, balanced diet. Include fruits, fibrous vegetables, foods containing omega 3 fatty acids, and nuts, especially walnuts, in your diet. Limit salt and foods containing saturated fat. Be physically active. It is recommended that you do brisk walking or jogging, basically exercises that make your heart rate go up, for at least 30 minutes over 5 days a week. Exercise helps the muscle to utilize the sugar and help to reduce the sugar levels in the blood. Limit alcohol. If you smoke, ask for help to stop. If you're overweight, try to get down to a healthy weight. Any weight loss will be of benefit. Take medications as advised by your doctor and attend your annual follow up to check your sugar, blood pressure, and cholesterol and have them under control. And do not hesitate to talk to your doctor if you have any concerns or if you need any help. If you have diabetes, it is very important that you take care of your feet. Try not to injure your feet and wear appropriate socks and shoes. Seek help early if you have any concerns so that you can prevent any major complications. I have provided a couple of useful websites for diabetes related information. Thank you.